Now on BBC News, it is time for your questions answered. Joining me this afternoon is Dr. Chris Smith, who's virologist at Cambridge University and also presenter of the Naked Scientists radio show. Thanks so much for joining us, Chris. We've got lots of questions, some really interesting ones as well. Let's start with something written in by Steve, who asks, why are we not seeing figures of those recovered from COVID-19 in the UK? All other countries are publishing this data.
I don't know is the straightforward answer, Steve. I'm sorry. But the bottom line is that we know what the mortality rate is. So therefore, one can presume that if you're not dead, you're alive and that you're going to be recovering. People recover at different rates, though. And I suspect this data will trickle out once we have a sure handle on actually how to collect it. But at the moment, I'm not aware of who's logging that data, so I can't give you any greater steer on that. But we do know that the mortality rate at the moment is about 1%. So therefore, 99% of people are getting better.
OK. A second question from Mr. Bradbury, he doesn't give his first name, who's in Cheshire. And he asks a very current question. Someone should ask ministers why everyone in the UK isn't getting a face mask to wear outside. Anything that helps the spread of this dreadful disease would help, ? Where do you stand on that?
Yeah, well, the current guidance from the World Health Organization actually is that face masks are not advised. The World Health Organization does not make the case for why they should be given out. That's not to say they're not very valuable in hospital, and we've heard a lot in the news in the last few weeks about PPE, personal protective equipment, and the types of equipment used in hospital, very valuable, very effective, very good at protecting healthcare workers. But if you're out and about in public, if you observe the normal guidance for social distancing and how to keep your hands clean, how to avoid other people who are the only source of this virus for you, then actually a face mask does not buy you much additional benefit. We know that the vast majority, more than 80% of the transmissions are occurring in the family unit or in the domestic setting. And most people, to my knowledge, are not wearing masks around their home. Therefore, we're of the mind at the moment that without the evidence to suggest they should be adopted on the wide scale, it's probably an expense that most people can ill afford.
And is there, in fact, a case against wearing face masks outside in that they give you a bit of a false sense of security?
People have suggested they may lead to a false sense of security. They've also suggested that if you touch a surface and have virus on your fingers and then you touch the face mask, then you can transfer virus to the surface of the face mask. And because people do spend quite a bit of time touching their face masks when they wear them, because A, they're uncomfortable, and because you're wearing them for a long period of time, they get itchy and people tend to adjust them. And also, you have to take them on and off to eat and drink anyway. And every time you touch the surface and deposit virus there, there's a chance that the virus will then go through the face mask, or when you take it off, you then spray virus back up into the air and you could then breathe it in at that point. So that's really one reason why they're not judged to be that helpful. The other is that the kinds of masks that we're seeing people wearing in public are just surgical face masks or even masks made from sort of cheap materials. If you hold those up to the light, you can almost see daylight through there. The material they're made of is not very good at filtering out small particles, and the viruses we're dealing with here are really tiny. They're about 1/10,000th of a millimetre across. So for them, slipping through a face mask, especially one that's been made damp by prolonged wear because your breath has got water in it, doesn't seem to help very much, which is why people are saying it's probably not going to buy people much additional benefit. So at the moment, on the basis of the evidence we have, they're not advising people to go down that road.
OK, that's very clear. Thank you. A question here from someone who doesn't give their name, but do we know how many people have actually died from or because of COVID-19 rather than the number of people who've died with it? And they give the example of Eddie Large, who sadly died recently. He was admitted to hospital with chronic heart failure. But was this actually because of the virus?
And this is going to be a really important question as we go further down the track. We do know that obviously people are dying of this, people who wouldn't otherwise be expected to die this year. For instance, I mean, our Prime Minister has thankfully recovered, but someone of his age with his prior medical history, as far as we know, would not be expected to die at his age. And for him to be in intensive care and as ill as he was argues that, you know, we're dealing with something which is a very serious health threat here. That said, at the same time, there will be people in the equation who catch this and they will succumb to it. And equally, if they'd caught the flu, they could have succumbed to that too. So it's not as clear as saying a death because of coronavirus is exclusively a death from coronavirus. It may be that these are deaths which, some people, it sounds bad to say it, but some people have said, is it bringing forward the inevitable for some cases? And the answer is yes, it is, because you've got people who are already in poor health, and it's the straw that perhaps is breaking the camel's back in this circumstance. So it's not as simple as saying a death from coronavirus is a death from coronavirus regardless of what else is going on. There will be a range of different health situations where some people it will be the primary source of death, other cause of death. In other people it will be a contributory cause of death.
So the next question is in fact linked to that one. This is something we've been debating in our household. How do the total number of deaths in the UK during the pandemic compare with, say, the average numbers for the same period over the last 5 years?
Well, there's a phenomenon called the excess mortality, and this is computed every year. Statisticians know on the basis of how many people are born and how many people die in our country every year. And we know those numbers very well because they're all documented. So we know roughly how many people we would expect to be dying at any moment in time. When we see a number that's either bigger or smaller than that, we know that something's changed the death rate. And in wintertime, we see what's called an excess mortality. These are more deaths than you would expect to see on the basis of chance alone. So what we're seeing at the moment is an excess mortality over and above what you would expect at this time of year, and those deaths are attributable, at least in part, to this new coronavirus. But remember that the flu also does this, and the flu claims up to 10,000 lives in an average winter. So this virus has only just about matched what we achieve with the flu in the average year at the moment. So one has to keep a sense of proportion.
OK, that's very, very useful. Thank you. A question here, again, no name given, but they ask, our son is in South Africa, and he says there's a lot of speculation there that countries who have a BCG vaccination programme, so against tuberculosis, have a lower death rate from coronavirus. At present, South Africa are claiming that they've had 25 deaths. Is there any truth in this claim? Should we be getting BCG vaccinations? I'm 77 and didn't have this vaccine as a child.
This is a paper that came out from the Johns Hopkins University in the States. This was about a week or so ago, and they showed that there's a really interesting correlation between countries that do use or have a history of having used BCG, which is a vaccine used to prevent widespread tuberculosis or disseminated tuberculosis infection in the body, and having a lower risk of a severe outcome or infection that's demonstrated with this new coronavirus. And they've actually followed this up with a bit more data since, showing that there are indeed fewer severe manifestations with coronavirus in people who have been vaccinated. And the benefit's not small. The suggestion is that people may be six-fold more likely to have severe infection with coronavirus if they haven't had the BCG. At the moment, they don't know why this is happening, and the paper that was published with this in hasn't been peer-reviewed. It's not been assessed or appraised by other scientists in the field. But the effect is sufficiently large and does appear to be or subject or standing up to scrutiny from a range of different statistical angles, that it's provoked a number of other scientists to now start small trials to see whether or not they can see a similar relationship in other groups of individuals, or even giving the BCG to people and seeing if it makes a difference. One theory is that it may be provoking a broad response of your immune system, which gives you additional protection should you encounter this new pathogen. The intriguing thing, though, is that the BCG is a bacterial challenge. It's a vaccine which uses a weakened form of a bacterium very similar to tuberculosis. And, of course, the coronavirus is a virus, a completely different entity entirely. But it just goes to show that the immune system is a complicated thing. And although we may not know exactly how it's working, if it seems to be beneficial, it may be a very useful and easy route to go down to give people additional benefit. In terms of the numbers of cases in South Africa, one must be very, very cautious about how you interpret data and testing and cases from other countries, because the way that they are testing cases and reporting data is not the same as, say, our country or any other country. I spoke to a friend of mine who is leading the response in Nigeria to the coronavirus outbreak there, and he said they've declared almost no cases, just a few hundred cases in the country, and he said he doesn't believe it because they haven't been testing anybody. So it's all down to how many tests you do. So be very cautious how you compare these numbers.
OK, good warning there. Another question now. This is from Johnny Rostron, and he says that he is part of an elderly couple. They are 67 and 75 years old, both with chronic underlying illnesses, so they are self-isolating for 12 weeks. But his question is, what comes next? If there isn't a vaccine and no cure, 12 weeks will turn into 12 months or more. We're lucky we have a garden. Many don't have access to outside space, and all that he can see is indefinite confinement.
Hello, Johnny, and I really do appreciate and sympathise with your predicament and the enormous number of people who are in exactly the same position. And the answer is there is no simple answer at the moment. Scientists are coming up with various ideas and theories, and politicians are considering them. Obviously, everyone's staking enormous amounts on a vaccine, but we're being told by vaccine researchers and experts in this field that this is not a short-term fix. It'll be at least a year, more realistically a year and a half, and that's with a fair wind behind it and no problems, before we have any kind of vaccine. And obviously, it's a huge ask for people to stay shielded at home for that length of time. People are also investing in looking at various drugs and other things that might help to mitigate against the infection. So that's a fertile avenue of research. And they're also considering other ways to perhaps achieve a degree of herd immunity in various countries, whereby we have a staged unlockdown. People are slowly allowed to return to work in different geographies and in different demographics. So you send younger people back to school, for example, younger persons from the workforce back into the workplace. The idea being that you achieve a degree of spread or transmission of the infection, but at a level that can be sustained and controlled and supported by the NHS. There's not that same profound, overwhelming response that the NHS would have to meet. That doesn't nonetheless solve the problem for those people who are stuck at home being shielded at the moment. And there is no easy fix, and I really am very sorry.
Yes. Rahul Chowdhury asks, in comparison to Germany, we have a lower infection rate, yet more mortality. Why? What are the Germans doing that we are failing to do horribly?
Well, people are asking this question and looking at this very hard. Obviously, again, one has to be very cautious about how you compare statistics, because what we don't know in each case is whether the statistics are being gathered in the same way, whether the numbers that are being reported include all the cases, include community cases, include all the tests that have been done, who's been tested, have the same profiles been tested. And then you've got to remember that different countries have different demographies, so there's different numbers of older people. Britain has one of the second highest population in Europe, so we've got a lot of people here packed into a very small area. So it may well be that the dynamics of our outbreak, in other words, how fast it's unfolding, is a bit different than other countries, and therefore we're all going to catch up in the long run. At the moment, we just don't know, and people are looking to countries like Germany to take their lead for guidance as to how we should perhaps manage the next phase in reversing the lockdown.
We have a question here from Stephen, which is a good question. He asks, what constitutes mild symptoms? Because, of course, it's the much more serious cases that we tend to hear about, isn't it? What are mild symptoms?
Well, the mildest symptom would be no symptoms at all. And we think that a significant proportion, as we learn more about this virus, of people who catch it fit into that category. It may be as many as 1 person in 3 who they catch it. You can demonstrate that their body is growing the virus. You can swab them. You can detect the virus in them, but it's just not producing any symptoms, or at least any appreciable symptoms. Mild symptoms might be, for example, you might not even have a fever. You might just have a slightly runny nose or a sore throat or a mild cough. You may not even have those symptoms, through to the more full-blown symptoms that people are describing with a relentless fever, persistent cough, and perhaps even having to go to hospital.
We're going to have to leave it there. Thank you so much for those
Pleasure.
very informative answers. That's Dr. Chris Smith, virologist at Cambridge University. Thank you.
Pleasure.